Will the House please come to order and members kindly take their seats? Members, I would like to update you on the order of bills. We were going to start with House Bill 739. We're going to continue down on this page with House Bill 817, House Bill 940, House Bill 50, and then we will turn back to the front of the calendar and start at the top with House Bill 585, House Bill 606, and House Bill 642. Before we turn to House Bill 739, I just want to remind members to watch the line of sight on the floor. We've had several instances of that happening today, and it's important that we keep that line of sight between the speaker and the member. With that, next is House Bill 739, which is an act relating to prohibiting the use and sale of the herbicide paraquat. The bill was referred to the Committee on Agriculture, Food Resiliency, and Forestry, which recommends that the bill be amended as printed in today's calendar. The member from Tunbridge, Representative O'Brien, will report for the committee. Please listen to the second reading of the bill.
739, an act relating to prohibiting the use and sale of the herbicide paraquat.
Member from Tunbridge.
Thank you, Madam Speaker. I thought I should start my report today with an observation. I doubt I am not alone here when sometimes during a report or a floor debate, I reflect that I have no idea what's going on here. The language is impenetrable. And I think like sailors and lawyers, we often use language here that is very hard to understand if you're an average Vermonter watching us on YouTube. So mindful of that, well, traditionally, I guess, fourth graders in Vermont study Vermont government, history, and geography. And sure enough, today, as I walked up to the State House, there was a gaggle of students outside, and all of a sudden a teacher said, "Fourth graders, listen up." And I thought, well, I should try to make this report accessible to those very fourth graders. So with that in mind, H 739, an act relating to prohibiting the use and sale of the herbicide paraquat. It's a strike-all bill, and it can be found on today's House calendar on page 1261. Okay, what is paraquat? As the original sponsor of the bill said in committee, introducing it, she said, it sounds like a combination of a pear and a kumquat. She was right as far as it is a combined name. If there are any chemists here who understand molecular structures, it comes from that. It's actually the para positions of quaternary nitrogens, paraquat. And paraquat is very old, too. I was surprised about this. Paraquat was first synthesized by chemists in 1882, but it wasn't until the 50s when its herbicidal qualities were recognized, and it was first started to be manufactured in 1962. What paraquat is not, I thought would be important to mention too. Paraquat is not Agent Orange, it's not DDT, it's not glyphosate or its common brand name Roundup. It's its own family of herbicide, and you often see this with pesticides or herbicides. They sort of come by families. So paraquat, there are various paraquats out there, but paraquat is its own sort of family. This bill is about banning paraquat, but let's first talk about what paraquat does really well, why it's still being used. It's considered a fast-acting, broad-spectrum, non-selective contact herbicide. It kills vegetation really well. So let me describe this. It's used in Vermont in a couple ways. If any of you have been to an orchard lately in Vermont, The old model of some 40, 50-foot high apple tree that you have to use ladders and maybe poles to actually get the top apples on, that's sort of over with. The new orchard model are very smaller trees, kind of mini trees, planted just a few feet apart in rows. And so for the customers, the U-pick customers, and even professional harvesters, it's much easier to get at the fruit. And you can also grow a lot more fruit per acre this way. So as these young trees are put in by our this new model in Vermont orchards, they are vulnerable to vegetation growing up around them. And so paraquat, if you spray it, it will kill all the grasses around these young trees. But its kind of genius is, because it just kills broadleaf vegetation, its genius is it doesn't kill the trunks of those young apple trees because it's not vegetation. So the alternatives to it, like Roundup, glyphosate, or some other various herbicides, like one causes the trees to canker. Roundup actually can harm the trunk of the tree because it gets into the biology of the tree. And so paraquat is favored by orchardists, and this is true of, we had the orchardist founder of Champlain Orchards who uses it and said it's very effective. It's also used, very little in Vermont, but it's also used around the US quite a bit as a desiccant. This is when you have a big crop and you want to kill the plants to harvest something. So say it's used a lot on cotton, where you want to kill the plant. It's used on peanuts, because peanuts are root crops, so you kill the top, and then you can send your commercial harvesters through. It's used on sunflowers, potatoes sometimes, you want to kill the top of potatoes, and also on soybeans, but very little in Vermont. It's mostly used by our orchardists here. It's considered an important tool in the so-called toolbox. We talk about this a lot. Like farmers, they need every tool they can access in the toolbox just to produce a crop that can compete both in Vermont and nationally, maybe even globally. So why ban paraquat? 2 reasons. Paraquat is highly toxic, like unbelievably toxic. If you actually ingest a teaspoon, you're dead, and there's no antidote. But it's also, if you sprayed it, for example, and you weren't using protective equipment, just in a molecular way, molecules can get into your lungs, and in your skin and cause permanent damage, both lethal potentially right then and there, or sublethal that may affect you years later. There's also a question about volatilization. This is when you spray it. Traditionally, it was thought to bind very well to the soil or to the vegetation that it was targeted to kill. But now this is in doubt, and new studies have revealed that it may actually travel, whether in the air or the water or in say, organic matter, up to and potentially more than 2 miles. So that all of a sudden, you're not just exposing the farmer or the custom applicator who uses paraquat, but potentially neighborhoods nearby, including schools or housing. The other reason, besides being highly toxic, the other thing you probably heard most about is there are growing definitive links between the use of paraquat and Parkinson's disease. So let me just talk a second about Parkinson's. After Alzheimer's, Parkinson's is the number 2, what's the word? It's neurodegenerative disease in the United States. Supposedly, or studies seem to indicate that over 1 million Americans have Parkinson's. My brother-in-law was just diagnosed last year with Parkinson's. A woman in committee handed me a note saying her husband had Parkinson's. It's an awful disease. It attacks both you mentally and physically. There's no cure for it. It often happens when you're older, and it tears families apart. Because there's no cure at the moment for it, it always ends badly in death. Madam Speaker, may I quote from a constituent and former farmer from Royalton?
Okay.
This former farmer said, "I have a very personal connection with this issue. I watched my father, a strong, athletic man, grow feeble, decline, and finally die from Parkinson's disease. My father was exposed to pesticides for years." There's also a cost with Parkinson's. We had the committee had a neurologist from UVM Medicine in who said that when you consider, you often get it late in life, but when you consider, say, loss of work years, and then you pile on medical costs to treating someone with Parkinson's, that the bill can come to $1 million pretty quickly. So if you think 1 million Americans at $1 million each, we're getting into some serious money here. The prediction is by 2037, Parkinson's will cost this country $80 billion a year. With Parkinson's, about 25% of the disease is attributed to genetic causes, but the other 75% are unknown. They're environmental. And that's where there are more and more studies, these meta-studies, showing that there's a link between paraquat and Parkinson's. Because of these two things, its toxicity and its link to Parkinson's, 70 countries around the world have banned the use of paraquat, starting with Sweden in 1983 and the EU in 2007. And then you think, well, 70 countries, that's a lot. And these are countries that aren't known for environmental or consumer protections, like Malaysia, Vietnam, Sri Lanka, Syria, Cambodia, Peru, Saudi Arabia, Chad, Gambia, Guinea, Ivory Coast, Mauritania, Mozambique, Niger, Nigeria, Senegal, Togo, it goes on and on and on. And you're saying, why is the US still using paraquat? Paraquat was available for almost anybody to use prior to 1978. In 1978, it became a restricted herbicide. But before that, like any of us could use it anywhere. So we've all been exposed, probably, unless you're really young. In 2021, the EPA banned paraquat's use on golf courses, residential lawns, and school recreational areas. So just because of the exposure was seen as it's not worth the risk. But it remained available to farmers as a restricted use pesticide. So you either had to be a farmer with a certified license to use it, or you would hire a custom applicator to use it. The member from Derby, for example, if he wanted to, he doesn't, but if he wanted to, he could buy paraquat and use it on his farm, but he couldn't use it on my farm, and he couldn't use it anywhere in a non-agricultural way. So there's an irony in this too, in that paraquat is banned among those countries, but it's banned in China, the UK, and Switzerland. All those countries still make paraquat, and it's still available for sale in Vermont. So here's some breaking news. It's not often in committee that we get really sort of hot off the press news, but in October 2025, the EPA, looking at all these volatilization studies, said, wait a minute, we better look more into this, because it appears more and more that there's this link between Parkinson's and paraquat. And then a fortnight ago, Syngenta, who is the largest manufacturer of paraquat, they're a Swiss-based company that's owned by an even bigger agro conglomerate called ChemChina, a state-owned Chinese company. But they sent out a memo saying they are no longer going to license or sell paraquat in this country. And we thought, well, that's odd because they're not getting pushed by the EPA, for example. But then legally, the weight of the sort of tort world seems to be wearing them down, that they're something like 6,500 liability cases brought against Syngenta for manufacturing paraquat. And Syngenta's already settled suits to the tune of $180 million with saying, not saying they're culpable, but just to make the suits go away. So you can see that if we're already at 200 million, say, in settlements, $1 billion's not far behind. And then I think in corporate boardrooms, they're thinking, well, maybe this pesticide is really not worth it anymore. They also, Syngenta, a couple years ago, withdrew the sale and licensing in Canada. So slowly, the makers of paraquat seem to be in retreat. And it's quite possible that the EPA at some point, maybe in the next 3 or 5 years, will ban paraquat, but it seems even more likely that the makers of paraquat are just going to stop selling it because liability-wise, it's just not worth it on a bottom line level. So now to the bill. It's a 6-page bill. It starts at section 1 with findings, which are pretty much what I've gone over, all the problems with paraquat. Section 2 starts with definitions, and they begin with what I was saying about families. We just wanted to make sure all variations of paraquat were going to be included in a ban. So it goes over that. Authorized use. What we're doing in Vermont, because we're trying to make Vermont both safer, but also be thoughtful of the orchardists who use it here. And we don't want to kneecap them and make it harder to make a living farming in Vermont. So the bill proposes a phase out to a ban. And it starts with the Secretary of Agriculture will issue permits to orchardists who apply for them in only certain situations, and there's going to be a lot more data involved in where you bought it from, how you're using it, what land you're using it on, so that we can track its use in Vermont. The ban itself starts November 1st, 2030. And then there's reporting, so that the Agency of Agriculture will report to this body how paraquat is used in Vermont, if it still is at that point. And then, because to take this important tool out of the toolbox of farmers, Section 3 proposes alternatives to paraquat, a study using the Agricultural Innovation Board. So we hope that that board, in connection perhaps with UVM Extension and the great universities, even locally, Cornell or Durham or Amherst, UMass Amherst, could look into ways to grow great fruit without paraquat, because, for example, the EU seems to have done this wonderfully. Interestingly, the 4 top producers of apples in the world: China, they produce half the world's apples; Turkey, the US, and Poland. And I thought the most interesting was Poland, because it's a climate almost identical to ours. They have cold winters, they have 4 seasons, they have temperate summers, and so it'd be interesting to study how they have moved on in a post-paraquat world and still grown great fruit. I think we can do it. Section 4, effective dates. The effective date for the passage is July 1st, 2026. The actual ban would be November 1st, 2026, because this was pointed out by our committee orchardist from Cabot that you don't really want to have a July 1st effective date, which is right in the middle of a growing season. So I think the legislature and the fiscal year don't often align with what farmers are doing on their farms. We heard from the Vice President of Science Policy at CropLife America, the neurologist I mentioned earlier from the Larner College of Medicine, UVM, the chair of the Department of Agriculture, Landscape, and Environment at the UVM Hort Farm, director of the UVM Hort Farm, the amendment sponsor, the director of Plant Industry Division, Agency of Ag, the senior government relations officer of the Michael J. Fox Foundation for Parkinson's Research, the owner and operator of Cabot Smith Farm in Cabot, the deputy director of the Plant Industry Division at Ag, an emeritus professor of agroecology at UNH Durham, the legislative counsel, and the founder and orchardist of Champlain Orchards. So this committee did a lot of work on finding that balance between making Vermont safer and also thoughtfully supporting our orchardists in Vermont, because it's actually historically and even to this day a really important crop, and we all love to go and pick apples and know that we're safe. The vote from out of our House Ag Committee was 8-0-0, unanimous, and we would appreciate this body's support.
The question is, shall the bill be amended as recommended by the Committee on Agriculture, Food Resiliency, and Forestry? Are you ready for the question? Member from Hartford.
Thank you, Madam Speaker. The Committee on Agriculture, Food Resiliency, and Forestry knows better than most that farmers have a lot on their plate. No one should have to accept an elevated risk of neurological disease as a condition of earning a living. Many applicators follow label instructions meticulously and still face exposure through drift, equipment failure, and long-term environmental persistence. Paraquat has a half-life in soil ranging from 16 months to over 6 years, and can also be transported through dust and residue on the crops that people consume. Just as farmers in 72 other nations have achieved economic success and high crop yields using alternatives to this exceptionally toxic herbicide, I hope our state can support Vermont's farmers in achieving the same. I've been so impressed by the contributions of each committee member and the way that they have come together to craft such a thoughtful bill. I hope you'll join me in voting yes on H739.
The question is, shall the bill be amended as recommended by the Committee on Agriculture, Food Resiliency, and Forestry? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have amended the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Now we'll turn to House Bill 817, which is an act relating to mental health support and substance use disorder prevention in schools. The bill was committed to the Committee on Health Care, which recommends that the bill be amended as printed in today's calendar. The member from Winooski, Representative Rebecca, will speak for the committee. Then carrying an appropriation, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass when amended as recommended by the Committee on Health Care. The member from Burlington, Representative Blumley, will speak for that committee. Please listen to the second reading of the bill.
H 813, an act relating to mental health support and substance use disorder prevention in schools.
Member from Burlington, Winooski.
Madam Speaker, H817 promotes youth peer-to-peer support programs, and it aims to improve how adults who work in schools recognize and understand youth mental health issues. I'm going to list some data about Vermont youth mental health issues to demonstrate why we need this bill. And I apologize in advance for the dour news, but there's really no way to sugarcoat it. Suicide is the second leading cause of death for 10 to 14-year-olds in America. May I share some statistics from the latest Youth Risk Behavioral Survey for Vermont?
You may.
1 in 4 high school students in Vermont report doing something such as cutting or burning themselves to hurt themselves on purpose in the past year. 1 in 15 Vermont students reported trying to kill themselves at some point in the past year. 34% of Vermont high school students said that their mental health was not good most of the time or always not good in the past 30 days. And only 1 in 5 of our youth reported that they haven't experienced poor mental health that month. So our kids have told us that only 20% of them can go 30 days without experiencing poor mental health. That includes stress, anxiety, and depression. So what have we done as state leaders to show families that we're listening in a meaningful way? Healthcare in Vermont is the most expensive in the country. We also have some of the highest property taxes. The majority of our mental health workforce could probably make more money working at McDonald's, in part because our state budget for their services doesn't keep up with inflation. A therapist makes 62 cents to every dollar earned by a physician assistant. So recruiting and retaining enough mental health workers in our state is a tremendous problem. One real-world impact of that is that when a Vermont kid is very sick and they need inpatient mental health care, they often go out of state to out-of-state providers, which forces their families to travel to visit them or for those youth to recover without family by their side. So I think I've established that our youth are having some serious mental health challenges, which clearly can keep them from being able to focus on learning. And Vermont's mental health providers are not exactly empowered to meet their needs. It's not the job of a teacher to provide mental health services, but by not providing teachers the tools that they need to recognize mental health challenges early on, we're failing both them and their students. What else do we know about how and what young people are doing? The Youth Risk Behavioral Survey data shows us that high school students who felt sad, anxious, empty, angry, or hopeless were most likely to talk about their feelings to a friend. 39% said that they would talk to a friend if they felt that way. But less than a quarter, 23% of them, said that they would talk to their parent if they were having those feelings. You may recall, Madam Speaker, that this body recently passed legislation that empowered peer-certified workers in Vermont to bill Medicaid for their services. The peer approach to mental health work is proven effective at reaching better outcomes than without it. And what do we know about youth peer-to-peer efforts specifically? Peer support strategies are being used to reduce bullying in schools. Circles of friends are groups of students who work as a team to support a vulnerable student, and befriending, a process where students are assigned to be with or to befriend another student. This is documented well in research published in 2010. Peer support has been used to help pregnant teens stop smoking. A 1998 paper reviewed interventions where a non-smoking peer acts as a role model for peers who smoke. Teen Talk is another youth health education program that offers peer support in the form of listening, referring, and educating about a peer-to-peer program and strategies for providing ongoing support, and modeling from one non-disabled pupil to a pupil with an individualized education program, or IEP. It encompasses both the academic and social domains, so benefits are derived by both pupils. Certified teachers in this model at appropriate grade levels must be teachers assigned to an elective peer-to-peer course program. The teachers may be in special ed or general education programs. And once the peers complete 35 hours of training, they develop and present skits at schools and sponsor info tables at school and community events, educating the entire community. Here in Vermont, in Mentor's DREAM program, Vermont youth are paired with a slightly older peer, and the younger student is guided and supported in academics and social development. Programs like Mentor Vermont and DREAM have been found to improve younger students' social skills, their willingness to follow rules, their overall sense of self-worth, and also school competence. And that's documented in a 2005 paper by Karcher. I want to highlight that this bill refers to grant programs, but it does not carry any funding. The bill also addresses mental health, but it doesn't involve any clinical services. The activities are directed at school-age youth, but this bill doesn't outline the use of or require any specific curriculum. This legislation is different because it's getting us upstream on mental health and prevention. This bill embraces successful, age-appropriate components of existing programs in our state. Many of them are federally funded, but they're not equally distributed or coordinated. And it asks our agencies to determine the best practices in the Vermont context. How can we keep our resources relevant and accessible to our youth, to their families, and our teachers? This legislation truly intends to build upon past investments to strengthen the protective factors for our kids, our teachers, families, and our economy. What we consistently hear about youth mental health is we need to build stronger connections earlier. We need to equip school communities with practical knowledge and create safe, structured ways for students to support one another without replacing professional care. And H817 is designed to do exactly that. If you turn to page 1264 of the House calendar, I'm going to do a section-by-section summary of the bill. Section 1 is about mental health literacy and peer support initiatives. The section establishes a new framework and statute that supports mental health literacy and peer-to-peer initiatives in schools and youth serving settings. It also clearly defines the purpose of the bill, which is to strengthen protective factors, increase mental health literacy, and expand access to developmentally appropriate peer support that promotes early identification of mental health challenges. And that's what I mean when I say upstream. Subsection B, this section allows, as funding is available, remember I said this bill doesn't have any appropriation, as funding is available, schools may apply for grants through the Department of Mental Health to provide training for educators and school personnel. The training may include understanding mental health conditions and substance use challenges, recognizing warning signs and risk factors, reducing stigma and promoting supportive environments, responding to students with empathy, connecting students to resources and services. Importantly, this bill does not mandate a specific curriculum. It allows for schools to propose approaches that meet their local needs. Subsection C, peer-to-peer mental health support. This subsection allows schools, after-school programs, and youth mentoring organizations to establish structured, supervised peer-to-peer support programs. And the key guardrails that are built in include programs that have to provide a structured way for youth to connect with peers. They have to be supervised by an adult. Programs have to emphasize connection to professional services when needed. And these programs are explicitly non-clinical, so they can't replace professional mental health care. And that's to protect both the quality of our clinical care standards we are used to here in Vermont. It also is to keep these programs cost effective. Plus, we know that youth talk to their peers about their feelings first, not their counselors or parents. This section also spells out that the Department of Mental Health is tasked with providing oversight and guidance, including setting parameters for the program structure and what the adult supervision would look like. Subsection D requires that the Department of Mental Health develop age-appropriate guidance because younger students need to focus on social emotional development and connection with each other, and middle and high school students should focus on stigma reduction, recognizing warning signs, and appropriate ways to respond to each other. That ensures that programming is effective for the developmental needs of students at their various ages. Subsection C is about reporting. We are asking the Department of Mental Health to submit an annual report to us here in the legislature that includes participation numbers, the program reach, and then broad findings and recommendations. This ensures that legislative oversight, and it allows us to really evaluate effectiveness over time as well as monitor demand for these services. Section 2 is the effective date. This bill would take effect July 1st, 2026. Madam Speaker, we cannot build a mental health system that only responds in crisis. By the time a student reaches a crisis point, we have already missed multiple opportunities to intervene earlier. So 817 is about prevention, early identification, and connection. This bill equips educators and school staff with practical tools. It aims to reduce stigma around mental health and substance use. It embraces the reality that students often turn to peers first, and it creates safe and structured environments for them to do that. Importantly, it reinforces, not replaces, the role of our licensed professionals. It also strengthens protective factors so that fewer young people reach crisis in the first place. I want to remind you that one in 15 of our high schoolers in Vermont told us that they tried to kill themselves at some point this past year. So I invite you to contemplate what you have done in this role, in this body, to support the youth in your community. Our kids are tomorrow, and tomorrow is our responsibility. So we need to tell our kids that we hear you and we are here for you. And this bill clearly tells our state agencies that our intent is for them to look at the existing investments that we are making and to lift up the best practices from those, to offer guidance to local schools and communities. This bill is demonstrating that we want schools to design and apply for grants that are right-sized for local communities. The House Committee on Healthcare heard testimony from the School Mental Health and Practice Development Coordinator at the Department of Mental Health, the Executive Director of the National Alliance on Mental Illness of Vermont, the Vermont chapter of the American Federation of Suicide Prevention, the board chair, trainer, and mental health professional at Northeast Kingdom Human Services. We heard from the Vermont Family Alliance, Legislative Council and the Office of Legislative Counsel, the Executive Director of Vermont After School, the Adolescent and Family Unit Director at the Department of Mental Health, the Public Relations Chair at the Vermont School Counselor Association, the Executive Director of Vermont Care Partners, the legislative page from Morrisville, 2 students from Winooski High School, the Vermont 2025 Teacher of the Year. And the House Committee on Healthcare voted 10-0-1 to recommend that the body vote yes to pass H817.
And now speaking for the Committee on Appropriations, member from Burlington.
Madam Speaker, H17 is amended by House. Healthcare carries no appropriation and as such has no fiscal impact on the state of Vermont. Our committee recommends the bill ought to pass by a vote of 11-0.
The question is, shall the bill be amended as recommended by the Committee on Healthcare? Are you ready for the question? Member from Ferrisburg.
Thank you, Madam Speaker. The reporter of the bill and I began a discussion prior to the presentation here, and we didn't get to finish that discussion, but we thought it might be beneficial for you and the rest of the body to be participants in that discussion, or at least hear the discussion. So we thought, if I could, Madam Speaker, interrogate the presenter of the bill for a friendly line of questioning.
The member from Winooski is interrogated.
So Generally, I absolutely support this bill, and I am in general support of bringing care down, especially mental health care, down to the lowest possible level. In other words, applying it at the lowest level as early as possible. Great. So these are some great ideas. But I also recognize the incredible importance that parents and guardians play and their involvement in their children's health and well-being. So I'm just wondering if the committee considered and how it might be worked in to provide notification to parents that this type of peer-to-peer or suggested peer-to-peer mechanism was being applied with their child at school.
Madam Speaker, it might be helpful if I walk us through an example of what this program would look like in action, or if we implemented it. So to the extent that funds were available, such as through a congressional earmark process, a SAMHSA Aware grant, a block grant, or philanthropic donation, the Department of Mental Health could design grants that schools may apply for. And that would be done through a state RFA process, a request for application, which is a fully public process. It's transparent to teachers, staff, parents, and students. So it's really upon our administration to propose the parameters of the project, both the peer-to-peer piece and the mental health literacy piece. And then it's really upon the school to define what they propose to do within those parameters that are set by the Agency of Human Services to meet the intent of this legislation that I've described in my report.
Okay, that sounds great. That the schools then, or the Department of Mental Health would construct the program for each individual school. I think that was is that my understanding of the answer?
The member from Winooski continues to be interrogated.
The Department of Mental Health would define a grant program which would be articulated in a request for applications that a local school could then apply for. And in their application, they would design what their local program would look like,
Okay,
including how parents were involved.
If I might continue the line of questioning, so would we be willing in our bill here to provide some criteria that would encourage the school's developed program to require parental notification when the peer-to-peer program is being implemented with their student?
Madam Speaker, as a parent, I really appreciate the sentiment of these questions. And in fact, we did, while working on an earlier version of this bill, which I presented to the Agency of Education and the Agency of Human Services, it was requested that we remove the sections that included parental notification and curriculum because the state does not mandate curriculum or require specific curricula to be implemented in schools, and that's where parental notification would lie in that statute.
Oh, okay. And I'm also wondering if in the peer-to, again, I know that we're not specifying particular curricula, but we're outlining some criteria that we want a school's developed program to meet, and I think that's what subsection B, 1A through H are kind of providing. Would we expect in those programs there to be a way, and maybe this is already specified in there and I'm just not reading it properly, is there a way to encourage that if within these adult supervised peer-to-peer sessions, not counseling, but sessions, that if some suspected domestic abuse might be occurring, is there a way for the DCF to get involved or a guidance counselor to get involved to kind of guide the session in that direction?
Madam Speaker, the school staff and employees are all mandated reporters of things like that. And further, I just want to clarify that A through H are related to the mental health literacy training, and what they are is lifting up recommended components as suggested by the Department of Mental Health. So those are not in the peer-to-peer section. Those A through H are actually for the mental health literacy training, which would be received by school staff and teachers.
Yes, I'm sorry. Yep, it was the A through C below. Yep, you're right. Okay, thank you, member. I appreciate the answers to the questions. Thank you, Madam Speaker.
The question is, shall the bill be amended as recommended by the Committee on Healthcare? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have amended the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Next is House Bill 940, which is an act relating to miscellaneous public utility subjects. The bill was introduced by the Committee on Energy and Digital Infrastructure. The member from Manchester, Representative James, will speak for the committee. And carrying an appropriation, the bill was then referred to the Committee on Appropriations, which recommends that the bill ought to pass. The member from Burke, Representative Kosenska, will speak for that committee. Please listen to the second reading of the bill.
H 940, an act relating to miscellaneous public utility subjects.
Member from Manchester.
Madam Speaker, H 940 is an act relating to miscellaneous public utility subjects, and the bill lives up to its title. It has three distinct policy pieces that are completely unrelated to each other. Section 1 is session law. It relates to how one of our state's three efficiency utilities, Burlington Electric, may spend some of its allocated funding for its upcoming 2027 to 2029 budget cycle. Sections 2 through 4 update and align the steps and timelines that our regional planning commissions and municipalities follow when they're seeking approval for their optional enhanced energy plans. And then Section 5 disbands the Telecommunications and Advisory Board, which was established in 2015, but has only met twice since 2021. I will now walk you through H 940, and members can find the language on our committee page in the H 940 bill folder dated Friday, March 13th. So Section 1, high level, Vermont has three efficiency utilities: Efficiency Vermont, Vermont Gas, and Burlington Electric. Our EUs receive funding from several revenue sources. One familiar source is the efficiency charge that ratepayers see on their bills based on how much power or gas we each use. The EUs invest this money specifically on programs that help Vermonters save money by using less electricity or natural gas. Another separate source is the money that flows from Vermont's participation in the Multi-State Regional Greenhouse Gas Initiative, or RGGI. RGGI revenues are allocated to EUs on a proportional basis, and the EUs in turn invest the money into programs that help Vermonters use less unregulated fuel. So typically that's the heating oil and propane that many Vermonters use to heat their homes. This is called Thermal Energy and Process Fuel Funding, TEPF, to introduce one more acronym. Vermont Statute 30 VSA 29E1 lays out how this TEPF money can be spent. It's very specific, and the law says, among other things, that TEPF funds can only be used to serve unregulated fuel customers, meaning customers who use propane, oil, kerosene, or wood for heating. This has posed a unique challenge for Burlington Electric, whose territory has 97% overlap with another EU, Vermont Gas. Burlington has near universal natural gas service. Therefore, BED has very few unregulated gas customers to serve with its TEPF money. That's why since 2020, Vermont's legislature, through the Energy Efficiency Modernization Act, has specifically authorized Burlington Electric to use its allotted TEPF funds more broadly, so that it could offer all of its customers programs that reduce fossil fuel use across the thermal and transportation sectors. BED has successfully used this money for a wide array of incentives, including offering its customers financial incentives for EVs, EV chargers, and heat pumps, working with Green Mountain Transit on electric bus incentives, and working with the Burlington School District to help test and develop a geothermal heating and cooling system for the new high school. The second 3-year EMA pilot ends this year in 2026, and that is why we are here today. Burlington Electric estimates that it will receive about $2.65 million in TEPF money during its upcoming 3-year budget cycle. BED needs to check 2 boxes regarding this money. 1, they need legislative approval to continue this flexible spending. And 2, they're well underway in getting this 3-year plan reviewed and approved, the usual process, by the Public Utility Commission with input from the Department of Public Service. Of this estimated $2.65 million, BED estimates that about $687,000 will go to DPS for measurement and verification of its efficiency program. This is a robust verification program, and it's how we ensure that efficiency dollars are being spent on programs that serve the market, serve customers, and deliver results. BED hopes to spend another $200,000 on programs that target its few oil and propane customers. Just as a reminder, that's the traditional use of this funding. They can help these folks with weatherization, for example. So that leaves $1.7 million in TEPF funding that Burlington Electric can't use unless the legislature grants them continued flexibility in this bill. As you'll see, we've put some parameters around it. So now we're going to walk through section 1. In subsection A, you see language that explicitly defines Burlington Electric, the 2027 to 2029 timeline, and the ability to use its upcoming TEPF funds and any small amount of carry forward money that might be left over from the current cycle on these more flexible programs that can reach all of their customers, as we've discussed. In subsection B, you'll see language that will require BED to prioritize weatherization with this $1.7 million. This criteria resulted from conversations that BED and the Department of Public Service had during our committee work. We asked them to work together on consensus language, and that's what you see here. 60% of the money, $1 million, must be used for weatherization, and 60% of that money, $600,000, has to target low and moderate income Vermonters with the kind of nitty-gritty pre-weatherization work that older homes often need before they can weatherize, like replacing old knob and tube wiring or replacing electrical panels. BED would use any remaining funds to continue its other programs like geothermal testing and providing EV charging units for renters and multifamily homes. In subsection C, you'll see that BED will seek approval in the Demand Resource Plan budget approval process. Again, this is already underway. And that it will report to the PUC annually on how this work is going. And finally, in subsection D, we simply clarify that BED's activity with this money doesn't count toward its separate and distinct obligation as a distribution utility under Vermont's renewable energy standard. So that was the most complicated part of the bill. The next 3 sections, 2, 3, and 4, in some ways are really kind of a long technical correction. So though it takes a few pages, it's really a very narrow update to the statutes that govern how towns and regions adopt their plans. So I'm always kind of big on background. So just briefly, every 8 years, our regional planning commissions must update their regional plans. These are long-term documents that guide action across broad areas like housing, economic development, transportation, and conservation. The plans are approved by the Land Use Review Board through a process that includes a draft, feedback, and public hearings. Towns may also adopt a local municipal plan. That's a similar process, but these are reviewed and approved by the region's planning commission. Regions and towns may also adopt an optional enhanced energy plan. Though it's voluntary, these plans are really important because once they're approved, they give the region or municipality substantial deference when the Public Utility Commission is considering siting an energy facility like a solar array. So this is a legal standard, and it means the PUC has to give the plan stronger weight when considering an application. So last biennium, the legislature required all 11 of our RPCs to adopt these regional plans on the same timeline. So this gives us a chance and an opportunity really to update all of these laws to streamline the process, make it more efficient, and align the timelines. So these revisions to Title 24 reflect the consensus request of the Land Use Review Board, the Department of Public Service, and our RPCs. So in short, quickly, in Section 2, subsection B, you can see that RPCs that are developing an enhanced energy plan will submit the draft plan to the Department of Public Service at the same time they're submitting their draft regional plan to the Land Use Review Board. Various changes without this section will, number one, streamline public feedback by consolidating it with the adoption of broader regional or town plans rather than having two separate processes. This should make it easier or more effective for Vermonters to weigh in. And two, it adjusts the timeline so that towns and municipalities don't experience a gap in having an approved energy plan. So that maintains their very important ability to have substantial deference. Section 3 makes technical corrections to 24 VSA 3450. That's the statute on how the RPCs review municipal plans with that same alignment goal. Section 4 amends 24 VSA 4352, the statute that sets the enhanced energy planning requirements. It updates the reference to Vermont's greenhouse gas reduction requirements, and it gets rid of an outdated renewable energy goal, replacing it with a reference to the renewable energy standard. So basically, syncing up steps, timelines, updating language. And finally, Section 5. This brief section disbands the Telecommunications and Connectivity Advisory Board. The TCAB was established in 2015 to advise the Commissioner of the Department of Public Service on the development of our state telecommunications policy and planning, with a very specific focus on expanding wired internet service to all addresses across Vermont. So folks, I think are certainly well aware that in 2021, Act 71 created the Vermont Community Broadband Board. And that organization has since been leading the state's goal to provide universal access to reliable, high-quality, affordable fixed broadband. So this has basically made the TCAB obsolete. And the TCAB has met only twice since 2021. They are asking to be disbanded, and the Department of Public Service supports this request. Madam Speaker, we heard from a wide range of witnesses on all sections of this bill, including the Director of Efficiency and Energy Resources Division at the Public Service Department, the Executive Director of the Northwest Regional Planning Commission, the Legislative Liaison for the Public Utility Commission, the Executive Director of the Land Use Review Board, the chair of the Land Use Review Board, the Data and Equity Policy Manager at the Department of Public Service, the Director of Regulated Utility Planning at the Department of Public Service, General Counsel for the Land Use Review Board, our own Legislative Counsel, Office of Legislative Counsel, the General Manager of Burlington Electric, the Managing Director of Efficiency Vermont, and we had written testimony from Vermont Gas. The House Energy and Digital Infrastructure Committee passed H940 on a vote of 810, and we ask for your support.
And now speaking for the Committee on Appropriations, member from Burke.
Thank you, Madam Speaker. Members of the Appropriations Committee received testimony from the Chair of the Energy and Digital Infrastructure Committee regarding H940 that proposes to allow the utilization of thermal energy and process fuel funds to advance work on additional projects related to transportation, weatherization, and thermal energy. Other initiatives presented to the committee include to require the adoption of a new telecommunications plan every 5 years instead of 3 years, which in the long run will save the state some appropriations there. To disband the Telecommunications and Connectivity Advisory Board and require the submission of draft regional plans from regional planning commissions to the Land Use Review Board as reported. Members of the Appropriations Committee received testimony from the Joint Fiscal Office that no appropriation is required to proceed with the purpose of H940 as detailed. And with a vote of 10-01, your Appropriation Committee recommends the bill ought to pass. Thank you, Madam Speaker.
So the question is, shall the bill be read a third time? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Now we'll take up House Bill 50, which is an act relating to identifying underutilized state buildings and land. The bill was referred to a committee of conference on the disagreeing votes of the two chambers. The Committee of Conference has met and considered the same and recommends that the House adopt its report, which is printed in today's calendar. Member from Fairfield.
Thank you, Madam Speaker. The Committee of Conference met, had an agreement. The Senate has thus agreed as well. The only change that we made from the bill as passed in this House was that we re-added the words "or state leased" in front of buildings in section C. And the Senate's reason for that is because they just want to have an inventory of what we do lease to see if vacant state-owned properties, if we could use them instead of leased property. So they just wanted that included. It was as a very small change, and we concur with we asked the body for the support.
The question is, shall the House adopt the report of the Committee of Conference on its part? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and the report of the Committee of Conference is adopted. Up next is House Bill 585, which is an act relating to health insurance reforms. Prior to third reading, the member from Castleton, Representative Harvey, offers an amendment to the bill that the first assistant clerk emailed to members at 1:51 p.m. today. This amendment is also posted on the House Overview webpage, and paper copies are available at the main table. Member from Castleton.
Thank you, Madam Speaker. And before I just give some brief remarks and focus on brevity, as I know that this is a marathon, I do want to extend my thanks to your Chair of Healthcare and to the Vice Chair and to the members of the committee for their hard work and for their time this afternoon hearing the amendment, which again will look very familiar as it is the exact amendment that my colleague, the representative from Ferrisburg, offered yesterday. Excuse me. Yesterday, as I laid out in some detail my concerns about Section 10 of this bill, the constitutional vulnerabilities, the undefined terms, and the ongoing 10th Circuit litigation out of Colorado that could give us guidance the guidance we need before we act. I won't repeat all of that now and relitigate the points, but those concerns, Madam Speaker, still stand. The amendment before us is straightforward. It's a simple strike of Section 10 in its entirety, and that I would posit to the body is the right outcome. It preserves everything else in this bill, the clinical decision-making provisions, the executive compensation transparency, among many other great pieces of legislation, while removing the one section that is not ready and that exposes Vermont to expensive, avoidable litigation. I urge my colleagues to support the amendment, and when the vote is taken, I ask that it be taken by roll.
The member from Castleton requests that when the vote is taken to be taken by roll. Is the member sustained? Is the member sustained? The member is sustained. When the vote is taken, it will be taken by roll. Member from Essex.
Thank you, Madam Speaker, and we thank the member from Castleton for coming into our committee today, and it allowed us to, again, have robust discussion around this. Your Committee on Healthcare took extensive testimony on this section of the bill. I want to make very clear that this section does not ban health sharing plans. It does not mean people can't choose these plans. This is simply consumer protection. We are asking that health sharing plans simply report to the Department of Financial Regulation their members and other financial information around shares collected and shares paid out. The intent of this legislation is so that we can have a more accurate picture of the healthcare landscape in the state of Vermont. Patients, Vermonters, are in an affordability crisis, and they are searching for options for healthcare coverage. We want to make certain that they are aware of all of their options, and we want to provide choice. And by the Department of Financial Regulation receiving information, Vermonters will be able to make more informed decisions. That is what this section is. So we urge, on a vote of 8-3-0, we found this amendment unfavorable, and we ask that the body please support your Committee on Healthcare and vote no on this amendment.
The question is, shall the bill be amended as offered by the member from Castleton, member from Montpelier?
Madam Speaker, may I inquire of the presenter of the amendment?
The member from Castleton is interrogated.
Just so I understand, if the amendment were to pass, Madam Speaker, would there be any state reporting requirements or transparency requirements for healthcare sharing plans?
I'm sorry, member, can you repeat that?
Sure. If the amendment passed, would there be any state reporting or transparency requirements for these healthcare sharing plans?
It's my understanding, Madam Speaker, that in conversation with the Chair of Healthcare and the rest of the committee, that DFR already has robust policies in place and that they are actively looking at this, which is actually what inspired the legislation as it currently stands. I don't think in terms of the reporting requirements, these healthcare sharing plans are something that are certainly a very nascent product and service that's evolving in the state, and really at the end of the day has been done because healthcare is unaffordable and unpredictable, and Vermonters are starving for some kind of assistance, and they're looking at viable alternatives to the healthcare plans that they simply can't afford.
I'm sorry, Madam Speaker, I don't think I heard an answer. Would there be any state reporting or transparency requirements if this amendment passes?
Not specific to these healthcare sharing plans, no.
Thank you. Is there anything in Section 10 that the member believes prohibits these plans from operating? Or again, does it only require transparency?
I thank the member for the question, and what I come back to is what I believe is an unfair targeting of the mechanism behind these plans. And there's what I believe, and I know other members of the body and certainly our constituents believe, are severe constitutionality concerns that are playing out in Colorado as we speak. And I think it would be extremely prudent, which I mentioned to the committee and to the chair, that maybe a study group is a reasonable alternative to look at what these plans would actually do, how they're being implemented and utilized in Vermont by the very Vermonters that need the ability to have plans that they can afford. Because at the end of the day, Madam Speaker, if the system was working the way that we intended, these healthcare share plans would not be necessary.
But again, just to follow up, Madam Speaker, would anything prohibit these plans from operating?
Again, Madam Speaker, it is not about prohibiting them from operating. It's about the undue and unfair targeting of the individuals that are utilizing these plans for their healthcare needs.
Madam Speaker, does the member have a sense of how many healthcare sharing plans are currently operating in Vermont, or how many Vermonters are enrolled in them?
I do not, Madam Speaker. Luckily, I'm on House Judiciary.
I thank the member. Madam Speaker, I don't know how many of these plans are operating either. I don't know how many Vermonters they impact, and that's the entire problem. These healthcare ministries use terms like plans, members, benefits. They have monthly payments that look a lot like premiums. One markets itself as an affordable alternative to traditional health insurance, but there's one difference. They have no legal obligation to pay. What we've heard is that Section 10 doesn't prohibit these ministries or redefine them as insurance. It simply ensures a basic level of transparency. And I think that's a reasonable expectation when Vermonters are entrusting any entity with their healthcare costs. I'd urge the body to vote no on this amendment.
The question is, shall the bill be amended as offered by the member from Castleton, member from Essex?
I'd just like to make clear, because I believe the presenter of the amendment indicated that the chair of House Healthcare advised that we knew, and maybe he can correct me if I'm wrong, but that we knew and I knew of how many plans there were and who they were. The point of this legislation is that we don't have that information. No one has that information. Department of Financial Regulation doesn't have that information. They would like this information, which is why this section is in the bill. This bill does not regulate healthcare sharing plans. It doesn't ban them. It places no restrictions on them whatsoever. It does not target religious organizations. Anyone can have a share plan. Any group with commonalities can create share plans. We are trying to, I believe the member from Castleton indicated that what we need is a study group. Section 10 is essentially that study group. We would like you to send information to the Department of Financial Regulation. If you have members in the state of Vermont, how many members do you have? How much have you collected in shares from them? How much have you paid out in medical claims? This is not equivalent to a contract between an individual and a company. That is fine. They can make those arrangements. But what these share plans do, it's important to understand that they then bind our healthcare providers into what is a private contract between a member and a share plan. And we speak an awful lot about provider burden and administrative burden in our committee. This supports and helps support our healthcare providers, because as it stands currently, many of these health sharing plans place a burden on the provider for administrative requests, for claims submissions, for third-party national health networks. That is why we are asking for information. The member would like a study group. This is that study group. Again, we ask that the body please vote no on this amendment. Let's support our administration and the Department of Financial Regulation.
The question is, shall the bill be amended as offered by the member from Castleton? Member from Castleton.
Thank you, Madam Speaker. I actually have a parliamentary inquiry of the body. It's my understanding pursuant to House rules that members are not allowed to photograph other members while they are speaking on the floor. Is that understanding correct?
Member from Castleton, your point of inquiry. Pictures are not permissible on the floor during proceedings unless the presiding officer has approved such request.
So I'd ask you, Madam Speaker, have you authorized pictures of members to be taken on the floor?
Can I see the members at the podium, please? The House will stand at ease. Will the House please come to order and members kindly take their seats? Will the House please come to order? Member from Castleton, the floor is still yours if you have other comments to make.
Thank you. No other points, Madam Speaker. the thing that we are constantly striving for in this body, and I feel like it is impressed upon us and other times lectured to us, to maintain decorum and civility, and to make sure that this august body debates with the seriousness and really the integrity that the people of Vermont demand. And I feel like that was lacking in the actions that I just saw. And whether it was the member that you and I spoke about or another member that admitted to doing it on the dais, you understand my concerns with it. And I thank you.
The question is, shall the bill be amended as offered by the member from Castleton? Are you ready for the question? Member from Milton.
Thank you, Madam Speaker. I would like to interrogate the presenter of the bill.
We are on the amendment.
No, okay.
The member is interrogated if she's, let's reset here. Member from Milton, we're on the question of the member from Castleton's amendment? Is
Yes.
it about that? The member from Winooski is interrogated? Oh, I'm sorry. Winooski? Can I see you at the podium for a moment? Okay. Will the House please come to order? Members, it has been a long day. Appreciate your patience with this. Member from Milton. The member from Essex is interrogated.
Madam Speaker, was any testimony taken from users of health sharing programs or administrators of these health sharing programs?
Yes.
Thank you, Madam Speaker, and I thank the member.
The question is, shall the bill be amended as offered by the member from Castleton? Member from Essex Junction.
Madam Speaker, the language in H585 brings transparency and accountability to healthcare sharing plans that operate outside traditional insurance oversight. By having this information, consumers can make informed decisions about their healthcare. A no vote is about basic oversight and protecting Vermonters, not taking away anyone's options. I ask the body to vote no on this amendment.
Are you ready for the question? If so, will the clerk please call the roll?
Arsenault of Williston.
2 minutes. Will the House please come to order? Will the House please come to order and members kindly take their seats? I would like to remind members that we are in the middle of a roll call vote. Members and guests are prohibited from using computers, phones, or any type of an electronic device. Please refrain from the passing of notes and conversation during the roll call. When the clerk calls your name, please answer in a loud and clear voice so the clerk can accurately record your votes. The question is, shall the bill be amended as offered by the member from Castleton? Will the clerk please continue to call the roll?
Austin of Colchester. Bailey of Hyde Park. Bartholomew of Heartland. Bartley of Fairfax. Rebecca of Winooski. Byron of Virgins. Bishop of Colchester. Black of Essex. Bloomley of Burlington. Boslin of Westminster. Bosch of Clarendon. Boonton of Berry City. Boyden of Cambridge. Brady of Williston. Brannigan of Georgia. Brigham of St. Albans Town. Brown of Richmond. Burdett of West Rutland. Burke of Brattleboro.
No.
Burkhardt of South Burlington. Burroughs of West Windsor. Berta Cabot. Campbell of St. Johnsbury. I'm sorry, Campbell of St. Johnsbury. Thank you. Canfield of Fairhaven. Carrie Sunken of Whitingham. Casey Montpelier. Casey Hubbardton. Chapin of East Montpelier. Charleston of Chester. Christie of Hartford. Chino of Burlington. Coffin of Cavendish. Cole of Hartford. Conlin of Cornwall. Cooper of Pownell. Corcoran of Bennington. Critchlow of Colchester. Tamara of Venusburg. Dickinson of St. Albans Town. Dobrovich of Williamstown. Dodge of Essex. Dolan of Essex Junction. Dolgan of St. Johnsbury. Donahue of Northfield. Duke of Burlington. Durfee of Shaftesbury. Eastis of Guilford. Emmons of Springfield. Feltus of Linden. Galfetti of Berrytown. Garifano of Essex. Coleman of Rockingham. Goodnow of Brattleboro. Ghostland of Northfield. Branning of Jericho. Greer of Bennington. Gregoire of Fairfield. Hango Berkshire. Harple of Glover. Harvey of Castleton. Hedrick of Burlington. Higley of Lowell. Holcomb of Norwich. Hooper of Randolph. Houghton of Essex Junction. Howard of Rutland City. Holland of Rutland Town. Hoyt of Hartford. Hunter of Manchester. James of Manchester. Kosenska of Burke. Keyser of Rutland City. Kimball Woodstock. Klepner of Burlington. Kornheiser of Brattleboro. Krasnow, South Burlington. Labor of Morgan. I'm sorry, Labor of Morgan. Thank you. Lally of Shelburne. Lumlone to South Burlington. Lamont of Morristown. LaRush of Franklin. Lipsky of Stowe. Logan of Burlington. Long of Newfane. Leaders of Lincoln. Luna of St. Albans City. McGuire of Rutland City. Malaya of Pittsford. Marquardt of Coventry. Maslin of Thetford. McKenna Montpelier. McCoy Pulteney. McFauna Berrytown. McGill Bridgeport. McLeod Milton. Mahoney of Calais. Minier South Burlington. Morganella Milton. Morgan Emma Milton. Morse of Springfield. Morrissey Bennington. Mora of Weston. Rowicki of Putney. Nelson of Derby. Nielsen of Brandon. Niger of Bennington. North of Ferrisburg. Noyes of Woket. Nugent of South Burlington. O'Brien of Tunbridge. Odie of Burlington. Oliver of Sheldon. Olson of Starksboro. Page of Newport City. Parsons of Newberry. Pezzo of Colchester. Pintonall of Dorset. Poucher Heinsberg. Powers of Waterford. Priestley of Bradford. Pritchard of Pollitt. Quimby of Linden. Rachelson of Burlington. Sakowitz of Randolph. Shai of Middlebury. Sheldon of Middlebury. Sebelia of Dover. Southworth of Walden. Squirrel of Underhill. Steady of Milton. Stevens of Waterbury. Stone of Burlington. Sweeney of Shelburne. Tagliavia of Corinth. Taylor of Milton. Taylor of Mendon. Tomlinson of Winooski. Torrey Moortown. Walker of Swanton. Wazzaq of Berry City. Waters Evans of Charlotte. Wells of Brownington. White of Waitsfield. White of Bethel. Winter of Ludlow. Wood of Waterbury. Yakavoni of Morristown. Bartley of Fairfax. Brigham of St. Albans Town. Casey of Hubbardton. Christie of Hartford. Dodge of Essex. Luno of St. Albans City. Malay of Pittsford. McGill of Bridport. Morganella Milton. Morse of Springfield. Mora of Weston. Nielsen of Brandon. Oliver of Sheldon. Olson of Starksboro. Page of Newport City. Parsons of Newberry. Quimby of Linden. Sakowitz of Randolph. Steady of Milton.
For purpose of explanation, member from Berry City.
Madam Speaker, as a religious person, I do have some concern with collecting this information. However, there are non-religious entities. Therefore, having the information is a reasonable request. I do think that there should be an exemption for religious organizations and or urge a future body to make one.
Member from Berrytown.
Madam Speaker, can I explain my vote?
You may.
I want to be on record as a person who voted no on this amendment. And the reason is I want to make sure that myself, my family, and all Vermonters can get the information they need to help pay for their health care. This bill or this amendment would take that information away. Thank you.
Members, please listen to the results of your vote. Those voting yes, 26. Those voting no, 104. The nays have it, and you have declined to amend the bill. Please listen to the third reading of the bill.
H585, an act relating to health insurance reforms.
The question is, shall the bill pass? Member from Essex.
Madam Speaker, as Vermonters continue to struggle with the high cost of health care, this bill, as the member from Barrytown told us yesterday, it strikes a very careful balance in the many measures that's in this bill. It increases transparency, needed tools for our regulator, and it supports healthcare providers. I urge the body to vote yes on H585. Thank you.
The question is, shall the bill pass? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill. Now we'll turn to House Bill 606, which is an act relating to firearms procedures. Please listen to the third reading of the bill.
H606, an act relating to firearms procedures.
The question is, shall the bill pass? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have passed the bill. Next is House Bill 642, which is an act relating to youthful offender proceedings. Member from Brattleboro.
Madam Speaker, I move that we delay action on H642 for one legislative day.
The member from Brattleboro moves that we postpone action on House Bill 642 for one legislative day. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have postponed action on House Bill 642 for one legislative day. Members, that completes the orders of the day. Are there any announcements? Member from Jericho.
Thank you, Madam Speaker. It's been a long day, so I will be brief. I just would like to wish the member from Williston a happy birthday.
Happy birthday, member. Members, earlier today, the Committee on Ways and Means reported favorable with amendment on House Bill 944, which is an act relating to the fiscal year 2027 transportation program and miscellaneous changes to laws related to transportation. Carrying an appropriation, the bill is referred to the Committee on Appropriations pursuant to House Rule 35A, pending its entry on the notice calendar. Are there any further announcements? Member from Waitsfield.
Madam Speaker, the education reform meeting that was scheduled for today will be rescheduled for next Thursday. Thank you.
Are there any further announcements? Seeing none. Member from Poultney, can you please offer us a motion to adjourn until Friday, March 20th at 9:30 a.m.?
Madam Speaker, I make a motion this body stand in adjournment until Friday, March 20th, 2026 at 9:30 a.m.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and this body stands in adjournment until